next superficial group, two rhomboid muscle. Rhomboid minor, lesser, Latin name minor, with rhomboid major, majoris, with great, and two serratus posterior superior, serratus posterior inferior, upper and lower. Yeah. Understand? Next, with two muscle, splenius colli, splenius capit and columnic.
Column.
Next, deep muscle divided in the three lobes. With first muscle, musculus erector spinae. Musculus erector spinae. Musculus erector spinae divided on the three parts: lateral,
Intermediate.
and intermediate. Lateral is iliocostalis muscle. Next, longissimus, and
Spinalis.
Молодцы. With suboccipital group. Divided four muscles: two rectus, two obliquus. Rectus inferior. Rectus minor and rectus major. Rectus minor, rectus major, and two obliquus inferior and superior, upper and lower. With thoracic muscle. Thoracic muscle include great pectoralis majoris. Next, pectoralis minoris, lesser pectoralis, with subclavian muscle, with serratus anterior, with two intercostal, external, intercostal,
Internal.
Understand? So repeat, students. Thoracic abdomen and abdominal cavity. Thoracic cavity and abdomen. With center tendon. With aortic hiatus of diaphragm. With esophageal hiatus, and opening cover.
Latin name musculus phrenicus. This is the main breathing muscle of our body. The diaphragm flattens and drops down, increasing the volume of the thorax. It has three parts. Look, the lumbal part, the costal part, and the little sternal part, three part. The sternal, located behind sternum. Sternal part, the large part, costal part, and lumbal part. You can see two cruces in the lumbal part: right cruise, left cruise of diaphragm. Then the diaphragm has three large opening. The aortic opening between cruces of the diaphragm, the aorta. Then the esophageal opening, esophagus, Latin name esophagus, going through the diaphragm. Esophageal. and the caval opening for cava inferior vein. Free opening aortic, esophageal, and cava opening for vena, Latin name, vena cava inferior, Latin name. That's all. This is diaphragm. Do you understand me? Okay. Then, now I show the muscles, all the muscles of the posters, and then we go to the cadaver. On these posters, you may see musculus pectoralis major, then musculus serratus anterior, muscles of the breast only. Then, behind musculus pectoralis major, you can see musculus pectoralis minor. This is a little muscle under clavicle, musculus subclavius. Then, musculus intercostalis externus, internus inside thorax. I show on the cadaver this muscle. Then, muscles of the abdomen. The muscles of the abdomen consist of three walls: anterior wall, lateral wall, and posterior wall. Anterior wall includes two muscles, rectus abdominis, and a little muscle, musculus pyramidalis. And rectus abdominis. Two muscles on the anterior wall of the abdomen. Lateral wall has three muscles: musculus obliquus abdominis externus, and this musculus obliquus abdominis internus, and the third muscle, musculus transversus abdominis. And the posterior wall of the abdomen has only one muscle. Do you know this muscle? No? Do you read this material at home? No? Musculus quadratus lumbalis. Musculus quadratus lumbalis. This is one muscle on the posterior wall of the abdomen. Okay. Muscles of the back. Muscles of the back consist of the superficial and deep muscles. Superficial muscles. Musculus trapezius, a large muscle, and a large muscle too, musculus latissimus dorsi. The first lower includes two muscles. The first lower superficial muscle. Then, on this poster, you must show two triangles in your practical skills: lumbal triangle and auscultatic. Look, this is auscultatic triangle. Borders: musculus trapezius, musculus latissimus dorsi, and musculus deltoidus. Auscultatic triangle. And this is lumbal triangle. Borders together: latissimus dorsi, crista iliaca, bonus, and lateral wall, musculus obliquus abdominis externus. This muscle. This is two triangle. Understand? Okay. Then the superficial muscles of the back, the second lower. Under musculus latissimus dorsi, you can see this muscle. Musculus serratus, toothed or serratus. Posterior inferior Then under musculus trapezius, you can see three muscles. 1, 2, 3. This is musculus levator scapula. Levator scapula. And two rhomboid muscles. Musculus rhomboidus minor and musculus rhomboidus
Minor.
under this muscle, the third lower but superficial muscle too. Number 4, musculus serratus posterior superior. Serratus posterior inferior, serratus posterior superior. Okay, this is the superficial muscles. Then the deep muscles of the back. On these posters you can see 1, 2, musculus semispinalis cervicis and capitis. Semispinalis cervicis and capitis. And on these posters you must show the deep muscle. The largest deep muscle of our body, musculus erector spina. Musculus erector spina. This muscle consists of three parts. Look, lateral part, musculus iliocostalis. Intermedial part, musculus longissimus, and medial part, musculus spinalis. Musculus iliocostalis, lateral part, intermediate part, musculus longissimus, and medial part, musculus spinalis. All musculus erector spina includes three muscles or three parts. Then, this is deep muscles of the back. Musculus spina is this muscle located between processus spinalis of vertebra and processus transversus of vertebra. Understand me? Transversus spinalis, spina transversalis. And the deeper lower of the muscle of the back, this group is named suboccipital muscles. Suboccipital muscles. This group includes 4 muscles. 1, 2, 3, 4 muscles. Look. Musculus rectus posterior minor. Musculus rectus posterior minor, musculus obliquus superior, musculus obliquus inferior. Do you understand me? Okay. Study the postures and the cadaver. Together with me. Look, what's this? External intercostalis. Okay. Internal intercostalis. Musculus transversus thoracis through the thorax or sternum to the costal ribs. Musculus transversus thoracis. Then one muscles you may see on of the anterior wall of abdomen. This muscle. Rectus, musculus rectus abdominis. On this cadaver, no pyramidal muscles. On the posters, show pyramidal. Then, lateral wall includes 3 muscles. Musculus external obliquus abdominis. Then, musculus obliquus abdominis internus, and this transverse abdominal. Okay. Then, look. 1, 2 muscles. Pectoral muscles. Musculus pectoralis. Musculus pectoralis. Okay. You must know 3 triangles over the anterior wall of the axillary cavities. Look. The first triangle, musculus, triangle, clavicular pectoralis, between clavicle and superior, margo superior of musculus pectoral minor. The second triangle, musculus pectoralis. This triangle between superior margo and inferior margo of this muscle. And the third triangle, musculus subpectoralis, between inferior margo of musculus pectoralis minor and inferior margo of musculus pectoralis major. Do you understand me? Okay. What's this? Diaphragm. Okay. Diaphragm. This is diaphragm. Then there on this cadaver you may show musculus quadratus lumborum and one muscle of the posterior wall of abdomen. Look, this is musculus quadratus lumborum between the last rib and iliac bone. Musculus quadratus lumborum. Okay? Wait 1 minute, please. This is linea alba. The linea alba is a fibrous line. It is formed by the aponeurosis of the free, flat muscles of the lateral abdominal wall. External oblique abdominal, internal oblique abdominal, and the transverse muscle. This muscle has aponeurosis. This is a vertical line between processus xiphoideus sternum and pubic symphysis. Okay, then the rectus sheath or vagina or bursa vagina of the musculus rectus abdominis encloses the rector abdominal and pyramidal muscles. It has anterior wall and posterior wall. This is vagina and sheath of this muscle. Anterior wall is formed by the aponeurosis of the external oblique muscle and a half of the internal oblique muscles. Posterior wall is formed by the aponeurosis of the half of internal oblique muscle and the transversus abdominal muscle. And at the end, the inguinal canal. Do you know inguinal canal of our body? Canalis inguinalis, Latin name. This canal norma of our body. In man, the spermatic cord pass through this canal on this cadaver. Look. This is the inguinal canal. This is the in man. This is the spermatic cord passes through this canal. This canal has 2 ring. The superficial inguinal ring. Look, superficial ring and deep ring. The superficial and deep. This canal has 4 walls: anterior, posterior, superior, and inferior. Look. This is the inferior wall. The inferior wall is formed by the inguinal ligament. Look, anterior wall. What's this? This is aponeurosis of musculus obliquus abdominis external. Anterior wall. Posterior wall, this is posterior wall, is formed by the fascia transversalia, and the superior wall, is formed by the two muscles, margo-inferior of two muscles, internal oblique and transverse abdominal muscles. Again, this is canalis inguinalis. It has four walls. Anterior wall is formed by aponeurosis of the external oblique muscles. Inferior wall is formed by inguinal ligament. Superior wall, margo-inferior of two muscles, internal oblique and transverse, and posterior wall, fascia transversalia. No, muscles fascia. In man, the spermatic cord passes through this canal. In woman, the round ligament of uterus. That's all. This is conspect 2. How many muscles includes posterior wall?
Two. External obliquus.
One. Quadratus lumborum.
We give your concept right in your textbook. Mistake, because psoas muscles, it is muscles of the pelvis, not of the abdomen. Understand me?
Psoas major minor.
It is not muscles of abdomen. It is muscles of pelvis.
Pelvis.
Internal group.
Lumbar muscle.
So one muscle of the posterior group, quadrate lumborum muscle. Lateral group includes three muscles.
Three muscles.
External oblique abdomen, under internal
Obliquus
and
muscle.
under transverse.
Transverse fascia.
Three muscles. These muscles have aponeurosis. Yes?
Aponeurosis.
External oblique, internal
oblique and
transverse has
transverse.
aponeurosis. Aponeurosis, it is tender fibers.
Tender fibers, yes.
And anterior wall includes two muscles, rectus and a little
Pyramidalis.
pyramidalis. Rectus muscle has what is it?
Tendinous inferences.
Yes, bridges. So then you must know topography of the abdomen. Yes.
Rectus.
For example, a white line, linea alba. This is linea alba. Goes from xiphoid process to pubic symphysis. Yes? How formed linea alba? How formed? Yes. Aponeurosis of the both sides of the muscles of the lateral group. Yes. Okay. Then you must know inguinal canal. Inguinal canal, this, right?
Yes.
Man and woman have inguinal canal, length 4 or 5 centimeters, right?
Yes.
Contains in man
Superficial ring.
no.
Spermatic
cord.
And in the woman, round uterus, round ligament of uterus, round ligament. You must know it.
Yes.
It has two rings. Yes, it is superficial ring.
And deep.
Annulus, Latin name annulus. Deep ring we cannot show. Only on the
It's
cadaver, yes.
inside.
And also we cannot show transverse fascia.
Yes. Yes.
But you must know walls of the
Transverse
inguinal-
fascia is somewhere here only, no?
transverse fascia,
Yes.
posterior
There.
wall. You must know how formed each wall of inguinal canal. Transverse fascia, posterior
Posterior
wall.
walls.
Anterior wall, what is it? It is anterior wall.
Anterior external oblique aponeurosis of external oblique muscle.
Is formed by aponeurosis of
And half
external-
enter-
No.
Only aponeurosis.
Only upper.
No rectus.
Nectar rectus
It
is
is
yaar.
walls of inguinal canal.
Aponeurosis
Anterior wall is formed by aponeurosis
Neurosis
of
of
the
external oblique muscle.
Inferior wall is formed by inguinal ligament.
Ligaments.
Right?
Yeah.
Inguinal ligament and superior wall.
Superior.
It is lower edges of two muscles.
External and
Internal oblique
and transverse fascia.
Understand?
Abdominis.
You must know how formed each wall of inguinal canal. Okay? And the last, rectus sheet. Rectus sheet. It is the bursa surround rectus muscle, which surround rectus muscle. It has anterior wall. This is anterior wall and posterior
Posterior
wall.
wall.
Also, you must know Douglas linea. Yes, linea between two
Iliac.
spina iliaca anterior superior. This is line. Above this line, rectus sheet
Yes.
is formed by anterior wall.
Posterior wall.
Yes, and above and down
Posterior.
sheet has anterior and posterior wall, but difference in their structure. Above anterior wall is formed by aponeurosis of external
External
oblique and
oblique,
a half of aponeurosis of internal,
Interoblique
right?
muscle.
Down from this line,
Inter.
a half
Internal
of
oblique muscle.
aponeurosis of internal
internal
and
and
aponeurosis of transverse. Right. Down from this line, down, free aponeurosis goes into anterior wall. Yes, anterior wall. That is why posterior wall hasn't aponeurosis, also has transverse fascia. That's all. Understand me?
Posterior has no
No aponeurosis down from this line.
No aponeurosis, only
transverse
internal.
fascia. A thin transverse
Internal and
fascia.
transverse fascia.
Muscles of the head consist of two groups, yes? Mimic expression, muscle of mimic expression, and masticatory muscle, yes? This is masticatory muscles. How many?
4.
Masseter
Deep. Temporal.
and pterygoid.
Pterygoid.
It is
Medial.
pterygoid.
Lateral.
It is
Lateral.
understand? Yes. Understand. Next, these foster mimic muscles. Mimic muscles consist of muscles of the roof of the skull, surround our eye, nose, and mouth, right? For example, you must know muscles of the roof, occipital frontalis muscle consist of occipital venter, obel frontal, and between two venters located
Gallia aponeurosis.
This is temporal parietal muscle. Also,
Procerus.
procerus. Okay. This is a large muscle, musculus orbicularis oculi. Yes, this consists of three parts. Yes.
Palpebral.
This is orbital part.
Supra.
This is palpebral part. And
Lacrimal.
the middle
Lacrimal.
of
Lacrimal.
Yes, this is lacrimal part. Okay. Nasal. Nasal muscles.
Transverse.
A lot of muscles which surround our mouths. Yes. For example, it is
Orbicular.
there is
Oris.
This is depressor anguli oris. This is depressor
Clavicular.
mental
Mental.
musculus mentalis. From angulus of mouth goes musculus risorius. This is musculus risorius. Two zygomatic muscles, minor.
My.
This is buccinator. Buccinator muscle. And two muscles, this. What is this? What is this? It is levator anguli oris and levator
Superior.
labius.
Superior.
Okay. It
Yes.
is not very difficult, right? Yes. How consist muscle? Two muscles in the first lower of superficial. It is platelet and sternocleidomastoid. Sternocleidomastoid has two cruris. Medial goes from our sternum and lateral. Yes, from clavicle. Okay. And connect with our mastoid process. That is why sternocleidomastoid. Okay. Between two cruris, you must know what is this. Fossa supraclavicularis minor. Fossa supraclavicularis minor. Yes.
Average measure.
Next.
मेजर कहाँ है
नहीं बता रही यार.
This is sternocleidomastoidus 2 muscle. Yes. Also, look, student, it is os Superficial muscles includes two groups also, suprahyoid group and intrahyoid group. This is suprahyoid.
Yes.
Includes four muscles. For example, what is it?
Digastric.
Stylohyoid muscle. Stylohyoid from styloid process of temporal bone. Yes. Look, this is digastric. This is anterior venter.
Posterior.
Myohyoid. This muscle, myohyoid. And a little muscle, geniohyoid. Intrahyoid group includes four muscles,
yes.
Two. Yes? Sternahyoid. Okay. What is this?
Sternothyroid.
Omohyoid. Consists of two venters. This is superior venter.
The inferior.
What?
Sternothyroid.
And continuing from this muscle, thyroid. A little muscle, this thyroid muscle. Okay?
Okay.
Also, you must know region and triangles over our neck. For example, anterior triangle or anterior region. This is anterior region. Borders.
Yeah.
Superior border, base of mandible. Two lateral border, sternocleidomastoid, and inferior border.
Midline of the midline of the
Okay.
midline.
This is lateral region. Borders. Sternocleidomastoid muscle,
Yes.
clavicle,
Clavicle.
and
Trapezius.
trapezius. How many triangles in the lateral region? Two. Right. Look, what is this?
Homoclavicle.
Right.
Homotrapezius.
Молодцы. Also, you must know four triangles in the anterior region.
Yeah.
The main triangle.
Carotid triangle.
Yes.
Yeah.
Carotid triangle includes the main structures of our neck. For example, arteria carotis communis, jugular vein, yes, and vagus nerve.
Vagus nerve.
Yes.
Homotrapezius.
Borders.
Yeah.
Sternocleidomastoid.
Omohyoid.
Superior venter, omohyoid muscle,
Omohyoid.
and posterior venter,
Digastric.
okay. This is carotid triangle. Students, what is this?
Homotracheal.
Right, omotracheal. And what is this?
Mandible.
Submandibular borders of submandibular borders.
Anterior and posterior digastric.
Yes, anterior and posterior venters of digastric and
base of the
base of mandible. Yes, and submandible. This is submandible triangle. And a little triangle lingual.
Sublingual.
Have you in the concept?
Yeah, situated in
lingual
submandible.
triangle of Pirogov.
Pirogov.
Pirogov triangle. Borders Margo of mylohyoid muscle. Posterior venter of digastric. And in your conspect, я вспомнила, I remember, technique of hypoglossal nerve, not sublingual, hypoglossal. Hypoglossal nerve. Okay?
Pirano.
What's this?
Located in the submandible.
Lingual triangle.
Submandibular.
Posterior venter of digastric and mylohyoid muscle. In the posterior, absent hypoglossal nerve, yes? Present in the body, in this. So, that's all.
Submental. Yeah.
Give me your
Expression and muscle of the mastication. This is posters. Latin name masseter muscle. There are 4 muscles, masseter muscles. This is musculus temporalis. Lies in the temporalis fossa of the cranium. This is musculus masseter. And number 3, number 4, musculus medial and lateral pterygoid. This is 4 masticatory muscles. Okay? Medial, lateral. Muscles of the facial expression consist of muscles of the roof of the skull, muscles of the orbit, of the eyelid, of the nose, mouth, muscles of the roof of the skull, occipital muscles, consists of 2 venters. This is venter frontalis. This is venter occipitalis. Between these venters, you can see galea aponeurotica. This is aponeurosis too. Galea aponeurotica, named galea aponeurotica. And this is musculus tempora parietalis. Tempora parietalis. Look, this muscle. Musculus procerus. Musculus procerus. From the nasal bone. Musculus procerus. Then the muscles of the eyelid and orbit. Look, this is a large muscle. Musculus orbicularis oculi. It has 3 parts. This is palpebral parts. This is orbital parts, and a little. Look, this is lacrimal part. Lacrimal, palpebral, orbital part. Then muscles of the nose. This is nasal muscle. It consists of 2 parts, transverse parts, and ala part from ala nasal. And there are a lot of muscles you can see around our mouth. Musculus orbicularis oris. Orbicularis oculi. Musculus orbicularis oris. It has 2 parts. Labial part, and angular part. Then, from the zygomatic bone, you can see 2 muscles. Musculus zygomaticus minor, musculus zygomaticus major. Then, musculus buccinator in our book. Lies in our book. Musculus buccinator. Then 2 muscles. Look, this is levator labii superior This is depressor labii inferior. Levator labii superior. Марина Александровна, чуть-чуть потише. Levator labii superior. Depressor labii inferior. Levator anguli superior. Depressor angulioris. Depressor. Levator. Depressor. This is musculus risorius. Risorius. Okay. If you have fossa in your bucca, you have this muscle. Fossa in your bucca. Laughing. I have this muscle. If you have a fossa in your bucca, you have this muscle. Okay? That's all. Again, together. Musculus accipita frontalis. This is venter frontalis. This is venter occipitalis. This is galea between these ventures. Galea aponeuroticus. This is temporal parietalis. This is musculus procerus. This is musculus arbicularis orbiter. It has 3 parts. Orbitalis parts, palpebralis parts, and a little lacrimalis part. Okay. This is nasal muscle. This is transversal part, alar part. Look, this is arbicularis oris, Latin name. It has 2 parts, lateral part and angular part. This is musculus risorius, zygomaticus minor, zygomaticus minor, buccinator, levator anguli oris, levator labii superior, depressor labii inferior, depressor anguli oris. Look, this is musculus mentalis. All this muscle is the muscle of the facial expression. Do you understand? Then the muscles of the neck. The muscles of the head, please. The muscles of the neck has superficial part, superficial muscles and deep muscles. Look, this is platysma. Sternocleidomastoidus. It has 2 cruces. Cruise. Medial cruise, and lateral cruise. Then, on these posters, you can see 2 subgroups. Suprahyoid muscle and infrahyoid. Where is hyoid bone? Hyoid bone, where is? Yes. This is suprahyoid group and this is infrahyoid. This group are the superficial muscles too. Superficial, no deep. The suprahyoid muscle has 4 group has 4 muscles. Look, digastricus. Digastricus has 2 venter. Venter anterior, venter posterior. This is musculus styloidus from processus styloidus of the temporal bone. Musculus styloidus. Then, what's this? Malar hyoidus from the basis of our mandible. And this is geniohyoidus, 4 muscles in the suprahyoid group. Digastricus, venter anterior and posterior. Stylohyoid, mylohyoid, and geniohyoid. This is intrahyoid group of the muscles. It consists of 4 muscles too. Musculus sternocleidomastoidus. Between sternum, our sternum, and os hyoidus. Sternocleidomastoidus. Look, Musculus sternothyroidus, between sternum and thyroid cartilage of our larynx. Larynx. This is sternothyroidus. And this is a little muscle, musculus thyroidus. Look, and the four muscles, musculus omohyoidus, oma from scapula, oma, Greek name, scapula omos. This is omohyoidus. It has two venters too, but not anterior, posterior, superior and inferior venter, superior, venter, inferior. Together with me, this is musculus. This is musculus sternothyroidus. This is thyroid, and this omohyoidus. It has venter superior and venter inferior. Okay? This is superficial muscles. And this is two. This is musculus trapezius, muscle of the back. Trapezius. Deep muscle consists of two groups. Lateral group and anterior group. Deep muscle. Look. This is suprahyoid muscle too, infrahyoid muscle. This is musculus omohyoidus. Venter superior, venter inferior. Deep muscles. Lateral group. Free muscle. Anterior scalene, medius scalene, and posterior scalene. Latin name musculus scalenius. Scalenius anterior, scalenius medius, and scalenius posterior. Okay? And this is lateral group, and you must know prevertebral or medial group. Prevertebral group. This is vertebral. This is prevertebral group. It has longus colli and longus capitis. Longus colli, longus capitis, and rectus capitis anterior muscle, rectus capitis lateral muscle. This muscle is in the medial or prevertebral group. Four muscles paired. Longus colli, longus capitis, what's this? Rectus capitis anterior, and rectus capitis lateral. This is scalenius muscle. This is lateral group. This is anterior group. This is lateral group. Do you understand me? Yes. And at the end, look, triangles of the neck. You must know the triangles of the neck, topography of the neck. Triangles and areas of the neck. Look. There are three areas of our neck. Anterior area, sternocleidomastoid area, lateral area. Look, sternocleidomastoid, like this muscle. Area like this muscle. Lateral area, borders of this area. Sternocleidomastoid, clavicle in the lower, and you can see two triangles in this area. This is triangle oma trapezius. This is oma clavicular. Look, border of this triangle. Sternocleidomastoid, trapezius, and venter inferior musculus omohyoidus. And this is the omoclavicular triangle borders. Sternocleidomastoid, venter inferior, and clavicle. Do you understand? And this is anterior area of our neck, bodies. Medial linear of our neck, medial linear line. base of our mandible, and anterior margo of the two sternocleidomastoid. This is anterior area of our neck. Triangle in this area, the carotid triangle. This is carotid triangle. Latin name trigonum caroticum. Bodies. Venter posterior of musculus digastricus, venter superior of musculus oma hyoidus, and sternocleidomastoid muscle. This is choroid triangle. Then the omotracheal triangle, the omotracheal, trigonum omotracheal. Bodies. Linea medial of our neck, sternocleidomastoid, and venter superior of omohyoid muscle, omotracheal triangle. Then the submental triangle, submental bodies, base of our mandible, and two venters, anterior and posterior of the musculus digastricus. And a little, the lingual triangle or Pirogov triangle, is situated within the submandibular triangle. Bodies, look, margo of, what's this? Musculus hyoidus, venter posterior of musculus digastricus. This is musculus digastricus, and I cannot show in these posters, but in men you can see the sublingual nerve, bodies of the lingual triangle. Musculus hyoid, venter posterior of musculus digastricus, and sublingual triangle. This is a little triangle within the submandibular triangle. Do you understand me? Yes. That's all. Practical skills? Epicranius muscle include occipital frontal muscle and galea aponeurotic, epicranial muscle, procerus muscle, musculus procerus, orbicular muscle of the eye. It has two parts. Three parts. Orbital, palpebral, and lacrimal. Orbicular muscle of the mouth. It has two parts. Labial,
angular.
Okay. Depressor muscle of the angle of the mouth. This is depressor. Depressor muscle of the lower lip. Submental muscle. Submental muscle. Buccal muscle. No. This is buccal muscle. Elevator muscle of the upper limb. Yes. Lesser zygomatic muscle. Lesser, greater zygomatic muscle. Risorius muscle. Where? Risorius. Okay. Masseteric. Then masseteric muscles. Wear your mask. Are you ill? Masseteric muscle, temporal muscle,
lateral and medial.
no, lateral and medial, no, in the practical skills. Saphenous muscle of the neck. Platisma, musculus platisma. Sternocleidomastoid muscle. Okay. Then suprahyoid muscle. Digastric muscle. Digastric. Venter. Anterior venter. Stylohyoid muscle. Okay. Mila 1M. 1. Milohyoid muscle. Okay. Geniohyoid muscle. Infrahyoid group. Sternohyoid muscle. Sternothyroid. Thyroid muscle. Anterior scalene muscle. Lateral group deep muscle. Maybe in this posture. Maybe. Anterior, medial, and posterior scalene muscle. Lateral group deep muscle. Long muscle of the neck, long muscle of the head. Anterior, deep anterior group of deep muscle. A long muscle of the neck or colli neck. And long muscle of the capitis of head. Do you understand me? This deltoid, supraspinatus, infraspinatus, teres minor, teres major, and subscapular. 6 muscles, girdle of the upper limb. Okay. Then arm. How many groups includes arm? Groups, yes, 2, anterior, extensor. Anterior group flexor, posterior extensor. Look, this is posterior group. What is it? Posterior group triceps. Medial, head, lateral, and longus, free head. And a little muscle, anconus. 2 muscles, posterior group, it is extensor. Next, flexor. How many muscles includes anterior group?
4.
3. Biceps, long head, short head, coraca brachial, and under biceps brachial, just brachial, 3 muscles. Okay. Next, forearm. How many groups forearm? In the forearm. Groups, 2. Anterior, it is flexor and pronatory, and posterior, it is extensor and supinatory. This is anterior group. How many lowers? 4. Yes. First lower, 5 muscles. What is it? Yes, brachioradial muscle. Pronator, round pronator teres. Next, flexor carpi radialis. Next, palmar longus, and flexor carpi ulnaris. Нет, flexor carpi ulnaris. 5 muscles. Second lower includes only 1 muscle. This superficial flexor digitorum. 1 muscle. Next, third lower, 2 muscles. Deep flexor digitorum, this muscle, and pollicis. Flexor pollicis longus. And fourth lower includes 1 muscle, quadrate pronator. This. Yes? Or this, quadrate pronator. Extensor, how many lowers? Extensor, posterior. Yes, superficial and deep. What is it? Extensor, carpi, radialis, longus, and yes, brevis. Next, extensor, digitorum. Extensor, digitorum, and what is it? Extensor digiti minimi. Yes? And extensor carpi ulnaris. Yes? This is superficial muscle, deep muscles. What is it? Supinator. It is supinator. Next, long abductor.
pollicis, yes. Short extensor pollicis, long extensor pollicis, and extensor index, second finger index. Also, you must know muscles of the hand consist of three groups: tenor, hypotenor, and medius group. Yes, medius group includes 4 lumbrical muscles and interosseous. It is palmar interosseous, it is dorsal interosseous. Also, tenor includes short abductor pollicis, short abductor, and opponents, and flexor pollicis, short flexor. This muscle, abductor digiti minimi. Next, short flexor digiti minimi. It is hypotenor. And free sulcus in the topography, free sulcus, yes. What is this? Radial sulcus between what muscles?
Ulnar flexor.
What is it? No, ничего никто не знает. It is brachioradial muscle and flexor carpi radialis. Radial sulcus. Next, middle sulcus. Middle sulcus located between flexor carpi radialis and superficial flexor of digitorum. Yes? And ulnar groove between superficial flexor of digitorum and ulnar flexor. Without palmar longus. Palmar longus, it is not border. Understand? It is, what is it, student? What is it? No, it is retinaculum. Retinaculum extensorum. Flexorum. Excuse me, it is flexor. Flexorum. And under this retinaculum, carpal canal. This is carpal canal. Okay? That's all. It has 4 walls: anterior, posterior, lateral, medial. Anterior, posterior, lateral, medial. Anterior wall is formed by 2 muscles: greater and lesser pectoral muscles. Okay. Posterior wall is formed by 3 muscles. This is latissimus dorsi, musculus latissimus dorsi, teres major, and subscapular. 3 muscles. Okay? Lateral wall is formed by 2 muscles: biceps, and coraca brachial muscle. Biceps and coraca. And medial muscles is formed. I don't know, show on this cadaver, serratus anterior muscle. Serratus anterior. 4 walls. Again, the anterior wall is formed by greater and lesser pectoral muscles. Posterior wall is formed by latissimus dorsi, teres major, and subscapular. Lateral wall is formed by biceps and coraca, and medial wall, serratus anterior. Anterior wall has 3 triangles. You know it. Trigonum clavicular, pectoralis, and subpectoralis. You know it. And posterior wall, this is posterior wall, has 2 openings. Foramen trilateral, foramen trilaterum Latin name, trilateral opening in English, trilateral opening, quadrilateral opening. Trilateral opening, borders at the lower, teres major at the top, subscapular at lateral, caput longum triceps. Arteria circumflexa scapulae goes through this
opening, arteria circumflexa scapula. This is quadrilateral opening, bodies. At the top, subscapular muscle, at the lower, teres major, medial, caput longum, triceps, and lateral, column chirurgicum of humerus. From this opening goes arteria circumflexa humeri posterior and axillary nerve. Look on the cadaver. What's this? Foramen trilaterum. Bodies. Teres major, subscapular, caput longum, triceps, quadrilaterum. At the lower, teres major, subscapular, caput longum, triceps, and column chirurgicum, humerus. Do you understand me? Two opening on the posterior wall of the axillary cavity. Okay, yourself. This is the body. Lies near the scapula. Look, this is spina scapula. This is musculus supraspinatus, musculus infraspinatus, a little muscle teres minor, teres major, deltoideus, and in front area this is subscapular muscle, lie in subscapular fossa. Okay, 6 muscles. Again, what's this? Musculus
Supraspinatus.
Musculus
Supraspinatus.
teres minor, teres major, deltoideus, and subscapular. Okay, on the natural preparation. Look, this is spina scapula. This is musculus supraspinatus. This is infraspinatus. Teres minor, teres major, deltoideus, and in front subscapular. Understand? Okay. Then forearm under the muscles of the arm consist of 2 groups. Anterior group and
Posterior.
group. Anterior group flexors, posterior group extensors. This is anterior group, this is
Posterior group.
Anterior group consists of 3 muscles. Biceps. Where is biceps? Where is biceps? Okay, biceps has 2 heads or caput. Caput longum, caput brevis. Caput longum, caput brevis. Then this is coracobrachial muscle between processus coracoideus of scapula and humerus. And this is musculus brachialis. 3 muscles in the anterior group: biceps, coracobrachial, and brachial. And 2 muscles of the posterior group: triceps. The largest extensors. Triceps has 3 caputs. This is long caput, lateral caput, and a little medial, lateral, and longum. And this is a little muscles behind articulatio cubiti, cubital muscle. That's all. Muscles of the arm. Look. Biceps. This is biceps. This is caput longum, caput brevis. This is coracobrachial muscles. Coracobrachial muscle. This is brachial. 3 muscles: biceps, Caput longum, caput brevi, coracobrachial muscle, and brachial. Anterior group, flexor, posterior group. Posterior group, extensor. The largest extensor, triceps. Triceps has three heads. Caput. Caput longum. What's this? Caput lateral. Okay. And this is
Caput medial.
a little
Little
caput.
part.
And caput longum.
Long.
Caput medial.
Long. Lateral.
Longum.
Medial as a
Medial. Lateral.
Lateral.
And the little muscle, cubital. Behind articulator cavity. That's all. This is muscle of the arm. Then a lot of muscles of the forearm. The muscles of the forearm consist of two groups too, anterior group and posterior group. On the function, anterior group, flexory and pronatory. This is pronatory. Anterior group, flexor and pronatory. Posterior group, extensor and supinator. Pronator,
Supinator.
Anterior group consists of four layers. The first layer, 5 muscles. The first layer. This is on the posters and on the cadaver. This is for first layer. Musculus brachial, radial. Pronator teres, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris, 5 muscles. Brachioradial, pronator teres, flexor carpi radial, palmaris longus, and flexor carpi ulnar. Look. What's this? Brachia radialis. Flexor carpi radialis. Palmaris longus. A little venter and a longest tender. Then flexor carpi ulnaris. And this is pronator teres. Again, brachioradial muscle. Flexor carpi radial. Palmaris longus. Flexor carpi ulnaris. And pronator teres. 5 muscles in the first lower. The second lower has 1 muscle. One. This muscle. This is. Musculus flexor digitorum superficial. Musculus flexor digitorum superficial. 1 muscle in the second lower. In the third lower has 2 muscles. Musculus flexor digitorum profundus. This is superficial. This is profundus. And what's this? Look. Flexor pollicis longus. The third lower has 2 muscles. Musculus flexor pollicis longus, 1, and flexor digitorum profundus. And the 4 lower has 1 muscle too. 1 muscle, deep muscle. This is muscle. This is. This is pronator quadratus. Pronator quadratus. In the forelower, there is one muscle. This is pronator quadratus. Look, okay? A lot of muscle of the forearm. Then posterior group. Posterior group has two layers, superficial and deep. What's this bone? Named of this bone? Bone. Radius, okay. And on the radius you can see two muscles. Extensor, posterior group, extensor and supinator. Musculus extensor, carpi radialis longus. Musculus extensor, carpi radialis brevis, longus and brevis. Then musculus extensor digitorum and musculus extensor digiti minimi. Okay? And at last, musculus extensor carpi ulnaris. Superficial muscle again. What's this? Flexor digitorum and musculus extensor carpi radialis longus, musculus extensor carpi radialis brevis. What's this? Сейчас мы объединим. Да, сейчас я рассказываю. Extensor digitorum and extensor digiti minimi. And the next muscle, extensor carpi ulnaris. Superficial muscle. Do you understand me? And the deep muscle. Look, the deep muscle, supinator, extensor indicis, named of this part, this digitorum, index, pollex, index, extensor indicis, extensor pollicis longus et brevis. Look on this preparat. What's this? Tendon. Musculus abductor, pollicis longus, abductor. Then musculus extensor, pollicis brevis. Musculus extensor, pollicis longus, and what's this? Extensor indicis. Deep muscle. Again. Abductor pollicis longus. Extensor pollicis brevis. Extensor pollicis longus and extensor indicis. Supinator I cannot show you because it is lie under musculus extensor digitorum. Maybe on the posters. This is supinator. That's all. Then muscles of the manus. Manus has three groups. Three groups. Muscles of the manus of the hand. It's easy. Muscles of the hand consist of muscle of the tenor, muscles of the hippotenor, and medial group. Muscles of the tenor, hippotenor, and medial group. Medial group consists of musculus lumbricalis, 4. 1, 2, 3, 4. Lumbricalis, musculus lumbricalis, and deep muscle interosseus. This is musculus interosseius. Between os metacarpi. Between os metacarpi, musculus interosseius palmaris and musculus interosseius dorsalis. This is medial group of the muscle of the head. Then musculus of the tenor consists of 4 muscles. The superficial muscle, abductor, pollicis, brevis. Under this muscle, musculus opponens, pollicis, opponens. Under this is muscle, flexor, pollicis, brevis, flexor. And this muscle, adductor, pollicis. 4 muscles again. Abductor, pollicis, brevis. Under it, opponens, pollicis. Then flexor, pollicis, brevis, and adductor. And at last, musculus of the hypotenor in Latin. Musculus abductor digiti minimi, under it musculus opponens and digiti minimi, and musculus flexor, like this. That's all. Repeat yourself, and then I show you the topography, a little material about the topography of the upper extremities.
Muscle, yeah? Iliopsoas muscle divided 2 muscles, iliac muscle and psoas majoris muscle. Posterior group of the journal include maximus, gluteus. Next, medius and minus. This muscle, periform muscle, divided 2 whole Latin foramen, supra and infra periform. Yeah. Free lower limb divided 3 parts. With femur, with
Anterior.
and
Fourth.
yeah. This femur consists of 3 group muscles: anterior, medial, and
Posterior.
posterior. Posterior divided 3 muscles: with biceps, semi-tendinosus, and
Membranous.
Anterior group include 2 muscles: musculus serratus, musculus quadriceps femoris has 3 parts: rectus, lateral vastus, medial vastus, and intermedius. With intermedius. This medial group includes pelvic muscles with gracilis, with
Abductor.
abductor magnus, abductor longus, and abductor
Brevis.
with crus. Has 3 muscles: anterior group with tibial anterior, with 2 extensor muscles: hallucis and
Digitorum.
Posterior group include 2 parts: superficial and deep. Superficial gastrocnemius muscle, medial and lateral with lateral, and soleus muscle. Deep group include flexor hallucis, flexor digitorum, and posterior tibial muscle. Yeah. Lateral group consists of two peroneus muscle. Peroneus longus and peroneus brevis. Two peroneus muscle, longus and brevis. Foot consists of two parts, plantaris and dorsalis. Brevis extensor hallucis, brevis extensor digitorum. Understand? The next lesson has control.
Iliopsoas.
Okay. Iliopsoas. Great lumbar, Latin name, musculus psoas major. Iliac muscle. Piriform muscle. Look. Piriform. Maybe on this cadaver. Piriform muscle. Great gluteal muscle. Lesser gluteal muscle. Middle.
Medial gluteus.
Tensor muscle of fasciolata. Iliotibial tract. Quadrate muscle of teeth. No cadaver. On the posters, quadrate muscles of the teeth. External group of the muscles of the pelvis. External group. Sartorius muscle. The longest muscle. Sartorius. Quadriceps femoris, да? Quadriceps femoris. Biceps muscle. Posterior group, okay. Posterior group. Semitendinosus. Semimembranosus. Gracile muscle. No cadaver. Gracile muscle is absent. Gracile muscle. Medial group. Pectineal muscle. Look, pectineal muscle. Long abductor, short abductor, great abductor muscle. Crus, then long, short, great, magnus, Latin name. Crus, then crus. Anterior tibial muscle, where?
Anterior.
Long extensor muscle of the toe. Hallux. Long extensor. Then triceps. Posterior group triceps includes gastrocnemius and soleus. Long flexor muscle of the toe. Long flexor muscle of the hallux. Long flexor muscle of the toes. Latin name, musculus flexor digitorum. No, digitorum. Hallux, this. And between tibial, posterior tibial muscle. Long peroneal and short peroneal. Lateral group. Long peroneal, short peroneal. Topography on this material. Only on this material, not only on this. Okay?